Call the meeting to order. Do you have any public comment? Okay, election of chairperson.
All right, the only nomination we got at the last meeting, and I did have a conversation with Dr. Berger last Thursday or Friday, whenever he and I talked. Must have been Friday, because he was on his halfway to his vacation spot in Wyoming. I think is where he was going. And he accepted the nomination, and that is the only nomination I have at the moment. There are any other nominations for chair.
Motion to close nominations.
All in favor? Any opposed?
All in favor of?
All in favor of Dr. Brenner being chairperson?
Aye.
Any opposed?
He's out. You still got the rest of this meeting?
I was hoping he would be here. Changes to the agenda.
Yeah, 2 or 3 minor things that we need to add orderly. Under old business, we'd like to add prenatal clinic update and where we are. I don't know how we left that one off when we published the agenda last week. And then under new business, Tammy Kieser had to go to Raleigh. So the public health law update, that wonderful PowerPoint, 30-minute talk that we usually get, can be taken off the agenda. And then we want to add, well, it's adding C back, but with the heading of environmental workflow. And Kyle would have that conversation with us. So those are the 3 changes.
I have a motion to accept the changes to the agenda. Okay. All in favor? Any opposed? Any presentations? All right, we'll move to number 2, approve the minutes of the previous meetings. You want to read through those quickly? Or take a vote?
I make a motion to approve.
Second? Second. All in favor? Any opposed? Budget update.
This is an update based on the 3 motions made during the last board meeting. Commissioner Tate, having taken those back to the commissioners, and I went and stood before the commissioners and talked about several of them, and then had a meeting with Derek, and the commissioners tasked Derek to figure out one of the components, and he and I actually met a couple of times, and we think we have an answer to that. The first motion had to do with janitorial housekeeping services within the health department and funding that position, which wasn't funded in the original budget. As I said, I've had a couple meetings with Derek. We think we have a plan figured out on how to cover that service without costing the county any additional money. It's basically a realignment of some of the functions within the maintenance staff. We're actually going to have a written MOU signed by Derek and myself that specifies what the requirements for the health department are as far as occupational and environmental cleaning and disinfection of clinical areas. And we're going to attach the checklist that we've created several years ago and add a checklist for the adult dental clinic and child dental program to that with a schedule for how maintenance is going to carry that out. So that's the answer to that first part of the question. The second one, motion had to do with marketing funds that had been removed from the budget, and lab certification was the third one. And one that we didn't get a motion on, but I noticed when I went back and reviewed the minutes, was Junior Control had brought up communicable disease funding. We had taken some funds out of communicable disease. So Derek and I met, as I said, twice, and we've come up with an answer to all of those. We have a temporary position here in the health department that we're not going to fill, which gives us the funds, as I said the last time, to cover the physician contract time that that had been eliminated. But it also, there's enough there that Derek is allowing us to leave in place to cover the public health education component, which is the marketing component, which was $5,000. All of the requirements for lab for certification, which is about $3,600 that we put back in there. And some lab equipment maintenance money that we'd taken out, and we replaced that. And then the additional funds that we had left over, which is about $8,800, which originally was $9,000, is going to be put into contracted services for if we have a public health emergency that we need to use some funding for without having to go ask permission to spend that money on, say, IG if we had a Type A outbreak or something like that. So that we get it in place immediately without delay. So we've gotten an answer. I hope they're satisfactory to the board. They were to me on all three of those motions plus the CD funding. Any questions or comments? Or thank you.
Thank y'all for looking at it.
No, we appreciate your help too in getting that done. One other budget thing while we're on budget that I want to bring up, and we don't know the impact at the local level yet. The legislature, since about 2011 budget year, keeps taking the federal maternal child health block grant funds and redistributing to others other than public health departments. They were predominantly public health department money prior to that. And it's not that they're not good causes that they're giving them to. It's March of Dimes and Teen Pregnancy Prevention Initiatives, Healthy Start, Prenatal Quality Collaborative at ECU, the 17P program. But it's gone from, and up until this year, the state has taken an absorbed majority of what the change has been. So it's been as much as $1.4 million on the block grant money, but this year it's $4.7 million in the block grant money. And if you divide $4.7 million by 100 counties, that's the potential impact. But until the state runs those numbers through the Division of Public Health and makes a determination how much they can absorb, we don't know what the impact is going to be to us at the local level. So there may be some questions that I come back to you guys with that I'll have to take to the Board of Commissioners if they cut our maternal child health block grant money. It could be a challenge. That's a pretty good chunk of money. That's not a throw that in there.
All right, we'll move on to new business.
One more old business prenatal.
Oh, prenatal clinic.
Yeah, just to give you an update, we did appoint 3 folks to an ad hoc committee the last time in case I needed to have consultation with them about whether to contract with Angel or Harris. Well, Angel gave us the answer about 4 days after Board of Health the last time and said that they didn't think they were going to have the capacity in their outpatient OB clinic to provide or continue to provide services here. So we have had several conversations. About every 2 or 3 days we've been on the phone having a conversation with Harris and their OB, or their outpatient clinical program director, Deidre Vinson. And we've met with Steve Heatherly, the CPO, and we're trying to come up with a plan to cover our prenatal clinic here. And it's proving to be a little bit challenging to get them in place when our addenda to our contract with Angel, which goes through the 15th of August, ends. They're not willing to put anybody here from Harris until they feel they're fully staffed in their OB program. The concerns that we have as a health department are you're going to have 1 physician and 1 midwife at Angel. Harris is talking about 1 physician and 1 midwife in their practice here in Macon County. But we're losing 4 physicians and 3 midwives. 7 down to 4 is not a good ratio. We don't know what the impact is going to be on us. When Angel expanded their practice up there, of course, everybody that had a Medicaid card wanted to go to the private OB practice and not to the health department. Though the same providers were providing the service here, which kind of made little or no sense. But they all ran up the hill to the Angel practice, and the potential is that they may come running back down the hill. And and we may have to expand not only find somebody to provide our service, but at the same time, look for a plan to expand our service. But we won't know until they start knocking on our door. And that hasn't started happening yet. We don't expect that to happen until July 15th, when they close the doors up on the hill up there, and another provider leaves the clinic up, the outpatient clinic on the hill. So as they dwindle, we expect our numbers to go up.
Jim, what do we have in our budget to absorb the cost of that?
Not a significant amount of money. We have enough to pay a provider 4 hours a week right now in the contract that we have with Angel. And they gave us a very, very, very good deal in what they charged us. We're paying $400 a half day for an OB provider to come down to the clinic here. That's a great deal. We're talking probably $180 an hour to contract with somebody else for what we're getting for them for the 5 hours almost that they would hear a day on a Tuesday. Less than $100 an hour. We talked about it, I talked about it with Derek when we did the budget, but there's no way to speculate on how much we're going to need. We still have the money in there to do that 4 hours a week, but we have it in there to do it at 4 hours a week at $100 an hour.
So it could be 2 hours.
Yeah, the other pieces that are going to be challenging for us are referrals out of the building here, and getting the clients that we see to Harris for an ultrasound, because the agreement that we had with Angel, they're not going to renew for ultrasounds up there, so we go on to the same system as anybody else in the community, which is, we had an in before. We had specific set slots during the week that we would send people up there for ultrasounds. We're not going to have that anymore up there, so that's going to be a challenge for our clients. And then now, since they're not renewing that, they become just an ordinary Joe going into the practice or the hospital for an ultrasound. More than likely, if Mrs. Smith, made up name, is going to have a baby, she's going to want to have her ultrasounds where she's going to deliver her baby, and with the providers that are going to deliver it, more than likely, which means that we'll be trying to figure out how to get Mrs. Smith over to Harris. We've talked to them about their about their prenatal ultrasound equipment here. They're looking at the equipment they have that's been in this practice up here on the hill that they're thinking is old, that would need to be upgraded. They're also looking at equipment over at Harris that they may be able to redeploy over here, which would make it easier for the population to deal with to get an ultrasound. The other piece of that is that a lot of those people were able to get in under the Angel Indigent Care Program, because the majority of our patients are uninsured that we see through prenatal. So now we're going to be challenged with trying to figure out what Harris's or Duke LifePoint's indigent care program operates like. So we're having a lot of conversations right now on what the costs are going to be for those things.
But even if you get used and/or refurbished ultrasound equipment, you still have to have a technical staff to administer that and then someone to read it.
They do, yeah. And we currently, the way we do it through Angel is that we had an agreement that they would do any ultrasound for us for prenatal for $45, which was extremely reasonable. Originally, that included the reading of the x-ray. Well, I can't remember who the radiology group that was working, it wasn't at Hale at one time, that was working with Angel. When Mission converted that to Asheville Radiology, we started getting bills from Asheville Radiology, which is not our responsibility, it becomes the patient's responsibility. Some of them upwards of $1,000 for prenatal ultrasound for an uninsured patient. So it's working through all of those things that we're trying to do right now with Harris. But again, they've kind of put the brakes on a little bit in our meeting the other day. Until they have a provider, they're not willing to contract. So we are having conversations with Mayheck and we may be exploring other providers here in the community, which we've done before. We've had, when Dr. Borzak left the community, we had to get a provider from outside the community for almost 7 months until we could get the agreement with Angel in place. And I was gonna say, we're trying to build their practice. So it's the same thing that happened before, just a little more challenging because they're on the other side of the mountain from us. I have faith in that we'll be able to do it.
By the July?
By August 15th, that's our drop dead date. August 15th is the last prenatal clinic we'll have in this building with an angel provider. And we have had a midwife contact us, and I did talk to originally our liability carrier was steering us away from doing a midwife. But now that we're in the position we're in, I've had that conversation with her last Thursday. And they're okay with us doing a midwife. They just don't want us to do a midwife and have it full-time forever and ever. And that's the insurance company's wishes, so. But they're okay with doing it in the short term. They're also okay, they said, with doing it when we have a physician one week and a midwife the next week, if we had a contract with. Originally with Angel, because they had so many physicians, they pretty much said physicians only, and that's what we've tried to stick with. And but we've had providers here. Dr. Burrell provided prenatal care here before. Dr. Creel provided prenatal care here before. So yeah, I have faith that we'll go find somebody. We were able to find somebody the last time, so. And we're beating the bushes like crazy every day.
We'll move on to the business and fee plan, Diane.
Okay, and we'll turn to 4A. It is time, this time of the year, where we need to present our current fee plan for your approval. And I'll go over some of the changes and why we felt those were necessary. You'll notice the current fees are listed in that column indicated, and those are fees that have been approved by you at some point, probably over the last year. In the far right-hand column are either new charges or changes to existing services that we provide. You'll notice that there's a fairly long list at the beginning on page 1, 2, and 3 that are brand new fees. And those are services that will go along with our primary care and integrated care, so we can offer additional services. What we've been doing is just doing an office visit, so now we can actually code what service we're doing with the suture removals and so forth. We have added a few behavioral health codes, and that's just to get prepared for the integrated care that will be coming with the addition of the behaviorals. And then we had a couple of lab fees that were associated with a bundle, and we needed to make some adjustments with that. And what I mean by a bundle is the insurance company requires that we bill these services individually, but LabCorp does them as a bundle as far as the test goes. So that we were able to save some money. So you'll notice that those three were actually reduced in charge. We did not make any changes to environmental health or animal services except for a fee in environmental health where we added back, and this was a fee that had gotten removed a couple of years ago.
It was approved by the board, but somehow it got dropped from the fee plan at one time.
And that's the research fee of $15 minimum and $15 per half hour. Anybody have any questions? I will say that those new codes were based on insurance reimbursement.
On the environmental health, so that the $15 minimum for each request.
For the, well, it's a 30-minute charge with a $15 minimum.
That's for conducting research as opposed to merely getting records.
So if your request was completed properly, that would be.
That would not fall under the research.
We talked yesterday, and we were talking about, the example is Teresa brings in a list of property, the list of all the names of the owners of the property back when it was first purchased. When environmental health goes in, they go in and just go down the list of names, and they can find a septic permit or a well permit pretty quickly without having to do any research. But what happens is when a realtor, Jeff Todd, brings a plat number in and says, I need to find a septic permit for this piece of property, and you have to go research every owner that owned the property prior to that to try and find a permit somewhere for Mr. Jones 10 years ago that was permitted that the property was suitable for a septic system. It takes sometimes much more than 30 minutes to do. But the realtor is the one responsible for doing the due diligence, not the environmental health specialist when it comes to finding a piece of property or who owned the property prior to the permit being issued. So really what they're doing is the due diligence on the part of the realtor. And this puts the burden back on the realtor to either pay for the research that needs to be done or bring in the names so that they can quickly look up a permit or a previously issued permit. And we're going to talk more about permits and environmental health in a few minutes here. So if you want to hold on that fee until that conversation, we can do that. If you want to have more conversation about that, we can.
So we have a motion to approve the fees.
Sorry.
Okay, I'll make a motion to approve the fees. Let's hold that research fee until we discuss it.
All in favor? Any opposed? The billing,
And it's under the next tab over. We are required by all of our programs to have our billing guide reviewed and approved by you and the commissioners annually. So we went through and tried to clarify some wording and make sure that we're doing what we say we're doing, or adjust that where it would make better sense. So it's not that we removed adult health services, it's just we decided that it would fit better in a different category. So that's page 5. So if you'll notice on page 5 and 6, it looks like we've eliminated 2 programs, but we really haven't. We've moved those to the miscellaneous and general services on page 8. We changed the wording in the primary care section to go along with what you guys had already voted on with the changes in primary care, except for the age. And after discussing with Dr. Dewhurst, and the fact that I'm approaching that 59 too, and I feel like I'm pretty healthy, we would like to extend that to age 64. On page 10, it was just a little bit of clarification of what we currently do. And 11 will reflect the diabetes program and explain it a little bit better, which will also, with the new grant that we have with minority pre-diabetes education, we can no longer give the gift cards, so we removed that information.
Move to approve the billing account.
Second. All in favor? Any opposed? Motion carries. So I guess we can go to the environmental health workflow and the trial.
Yeah, I'll start off. We've gotten a couple of complaints recently in environmental health, and it's brought to light. We've known that our workload in environmental health is slowly but surely started to climb. But in the past couple months, it's really started to go up pretty significantly, which means that the environmental health specialists are doing much more time out in the field and less time being able to do and help out clerical staff with research and other things. We, back in 2007, 2008, at the beginning of the decline of the economy, we took it upon ourselves, the environmental health director and myself, and leadership here, to approach the county about, as we had attrition out of environmental health, not filling those positions. And we did that, trying to attempt to do that, and we did. To do that before, we were told by the commissioners you had to eliminate a position. So we have 3 environmental health positions that are kind of evolving. And we thought that the economy would continue to creep along like it's been. But we've been pleasantly surprised in the past month and a half. I don't think we're ready to go to the Board of Commissioners and say we need environmental health positions. That's not what I'm saying. But you guys are the ones that get the phone calls when environmental health isn't able to get out and get something done. So we thought we'd have a little bit of conversation about that tonight to kind of prep you if you get those phone calls and provide some insight in how we normally handle those issues. So you're on there.
All right, so just some specifics on increase in, getting busier. If we went ahead and ended the fiscal year now, this fiscal year, we've had 20% more applications than we did last fiscal year, and most of that has been in the past 2 quarters. In fact, first quarter 2000 of this year was the busiest quarter we've had in 9 years, which is amazing considering first quarters are usually our worst quarter. And the second quarter is looking like we've got a week left, but we're already at, we're at the same numbers. So, the workload is definitely, has increased to a point it's not been in a good while. Compounding with the research that we're talking about here is the realtors have had more put on them as far as disclosure whenever they sell property. So not only are they selling much more property, or I think right now, Tracy can speak more. There's a lot more listings right now than there have been in a while. They're also having to provide more items like septic permits for the property and the houses that they sell, and obviously where those records are kept. And the way research, just a little bit of background, Jim alluded to it, basically research is done by we're provided, if we're just provided with an address or, plat number, we'll go back and we have to search using the Register of Deeds information, using tax maps, mapping and tax office, search for property owners, and cross-reference that property with our database in order to find the correct permit for a piece of property. It could have been installed in 1973. That's how far our records go back, and we have to look for that. A lot of realtors are already doing this, and they're doing a good job of it. They'll do some of that research for us, and they'll provide those names. Those are we prefer that, obviously. We can get those researches out faster. We don't have that information easily take 30 minutes on some of these harder ones. And we've had a few that we've looked for on and off for a significant amount of time. And that's really tying up our clerical staff. And we're just not able to get the researches out to the realtors in a timely manner that we've been able to. We found some old records where 3 or 4 years ago we were doing researches at a rate of somewhere between 3 or 4 a day. Clerical staff told me they've done, one person did, she's done the bulk of it, but she's done 128 this month. Yeah, which is, that's a huge increase over, just from her doing it, that's a huge increase over what we've been doing. Of course, we still have the rest of the week, that number's going to be a lot higher, and she's not the only person doing research. So, what we're hoping, and our goal is to reach out to the realtors and provide some education on how they can give us this information up front, so that we can shift some of the burden off of our clerical staff, and the realtors can help us out with this issue, get those permits to them faster. Just want to reach out and teach them how to do that research if they don't already know that. I thought about speaking to their board, but what we're going to do is put together some information that we can send to each of the realtors so they can go through it and learn how to do their research, and also just explain where we are and why we've gotten to where we are with them requiring this of them.
One of the things that's happened, I had some conversation with 2 clerks back there the other day, and one of the complaints that we got is that as research comes in, it goes into the stack. The newest one goes to the bottom of the stack. But what's happened with one of them was they had a closing date. I think the closing date actually had to be moved. And then they were approaching the second closing date, and they still hadn't gotten to that point in the stack for research for that realtor. And it just so happened that that one took about 30 seconds to do, but it was under a stack 1.5 inches high. So we just want you guys to be aware that research has gone through the roof. It's not like we changed staffing in the section back there, but the research, the amount of research they're having to do, the volume has gone significantly high.
How long does it take?
I'm sorry, say again?
How long? Just if somebody calls for research today, is it 2 weeks, 3 weeks, a month?
Oh, no, I would probably put it within the week. It has been a little farther out than that. We've done the best we can to help clerical staff catch up.
I don't know if Jim mentioned it to you or not, but I got it earlier, I guess yesterday. We just got it. Do what?
We don't.
Okay. And just for y'all, we asked Derek to look in to see if we can't get all of these online. So like when you do a deed lookup, or if you bought a piece of property, we can tie that in and they can look up septic permits as well. And the realtors can do their own research online, which is
That's something that'll have to be done.
that might be a pipe dream, but we're going to check
Yeah,
into it. So.
there, of course, there's some issues, but if that's something that we could work towards, just some resources to get it done, that would cut down on a lot of stuff.
One more goal crease that action.
Yeah, we talked about that this morning. And then, like I said, I don't think we're to the point yet where we need to add environmental health specialists. That's not where we are, though. That's the #1 recruiting posting that comes across my desk any given day now. So it's picking up in a lot of parts of the state. So it'll eventually pick up here. But we don't know whether that point yet.
How far are you back, probably going to set the permits?
3 to 4 weeks. We went from about 2 weeks out, I'd say a month ago, to right now about 3 to 4 weeks. Which favors, or compares pretty favorably to some of the other counties around us. You know, to go from 2 weeks to 4 weeks in the span of a month or so is a pretty quick increase.
We'll put you on the spot here. How do you feel, personal opinion, how do you feel about our fees?
About our fees, here's my, I don't have an opinion on up or down. That's that's an ideology, political thing, who pays for what.
Right.
I have things that, we can look at making things more fair up and down on our fee scale. There are things that would probably be somewhat beneficial if we could split some of our fees, IP versus CA and things like that. As far as, getting our money from fees, getting money from the county, I don't have an opinion on that, but there are some, if we wanted to talk about fees, there are some structural changes that we could make to the fee structure.
It's mostly in the larger.
Yeah.
Tell what it is.
Don't you like the idea? What was that research fee again?
It's $15 minimum, and every 30 minutes is another $15.
So just,
And we haven't been charging for copies. We haven't been. Most of our stuff is emailed anyway, so there's not a copy fee. That's negligible. This is just for time spent by staff.
so that's almost, the minimum of $15 the last 30 days, that's right at $2,000 for research.
Yeah. It's probably less of a income thing and more of just if you can do some of the research, it'll save you.
Well, I agree. I agree. Is it fair for Emily to be paying for that person to do research for someone else that's selling the property? To me, it's a different opinion. But to me, it's just like my personal opinion is if you're installing a septic system, the rest of the county should be paying for it. If you're already installing it, it's my personal opinion. I know that's up for argument.
I agree with you 100%.
So I don't have a problem with the research fee. Do you think that the realtors can jump up and down?
Probably, at least some of them, but, I think if you give them instructions and they know that they should be doing that, you'll get permits with requests the way you'd like them to.
And I know there's a lot of realtors that already do this, and we appreciate that very much that they do. We'd like to bring everybody to that same level so we can give that better service to everybody.
I think, though, too, we can understand if we haven't done our job right, and it's taken them excess time to find what we need, then
I'm just,
And one thing with this individual, Mr. Closing Date, we have a system set up where somebody applies for a septic permit, and it's, they're buying a piece of property that's contingent on that septic permit. We get to that before their closing date, so they can make an informed decision. We've not really had this issue with research interfering with closing dates before, so we don't really have a mechanism set up there. One thing I would encourage, and I'll do this in my communication to the realtors, is if you have a closing issue, try to make that apparent to us so that we can at least try to help out with that.
We, even in the heyday, when we were fully staffed in environmental health and 3 positions that we vacated, when there, our turnaround time and on-site average is about 21 work days. And that's, my comments back then were, nobody decides to build a house in a month. Usually there's a lot of planning that goes into it, but all of a sudden now my septic permit is, I gotta have it today. That there needs to be some lead time, and that back then was the agreed upon lead time with county commissioners. unless it had site requirements or something else. We're slowly approaching that 21-day mark again with the manpower that we have to do the work. So just keep that in the back of your mind, that we want to continue to try and push that 21-day turnaround time, but it's going to be adequately staffed to continue to do that. But we'll see what this rise that we had in the last couple of months is, and see if that ride keeps either going or levels out or goes back down again. So we shall see.
Yeah, I think it'd be good just to give us a quick update on that this time of the week, maybe just keep them off, something we can jump on.
And Derek and I have talked about it a couple of times now, and we're of the opinion, you got to get things at the season and see what happens, especially in return of the economy. So before we start going to the commissioners and saying, we got to have something, but we want you to be aware of it.
Good luck.
Those issues
I'll
are
ride the bull. We're sure about it sometimes. It's pretty hard.
Appreciate it. Thank you.
So I guess we need to approve that fee of $15.
If you want to approve that $15 fee, yes, sir.
I think it's a good idea. I'll make a motion to accept the research fee.
No, the budget update is the
just
one that's included in the packet. Next month, though, we'll have the quarterly and the year kind of summary. It won't be the close of the year, but it'll be a summary of where we finished the year as far as expenses and the majority of revenues are concerned. By that point, our general revenues should have cleared the system.
Next meeting, requested agenda or discussion items.
We're going to put public health law update on there because that's an accreditation requirement. And there are a few things that when we went to the Health Worker League conference that we do every year that Tammy wants to share back with you guys. And another item that we might want to just add on there is kind of a summary of some of the, there's only 4 bills right now, well, 5 counting that crazy one today, but 4 bills that are kind of interest to local public health, 2 of which came from Macon County, that we want to kind of come up to the board and let you know where they lie at the end of the legislative season for this year. That's session rather than season, legislative session for this year. Legislative season. We do have 2 things. If you guys have anything else that you'd like us to bring up or discuss, we'd be happy to add it next month.
I have 2 items. One, if you can give us an update on just on the permits and environmental health. And then 2 is I would love a tour of the facilities if we spend 15 minutes.
We can do that too. We'll get Van and Jennifer down there to give you a tour of the clinic. And more of the rest of the building. If you want to see animal control or anything like that, we can take you down the hill too if you want to do that.
Yeah, I'll walk through it, but I don't know what the moving pieces are. I think it'd be good when we discuss things in here.
Yeah. No,
Let's
that's
do our
a
minds what we're talking about.
Channel parks too.
We might have to put 2 or 3 cars out front, put people in.
Bring them all
Yeah.
over.
It's like Tyler and Jimmy's chauffeur and Jennifer's. Point.
I know, we
Thank
can
all of you.
We can do that.
Motion to adjourn?
Second.
All in favor?
I'll make a motion, you second.